Hi, I'm Jesse Schuschu. I graduated from Berea High School and I'll be going to the University of Pennsylvania in the fall. I'm part of the science internship program at the Cleveland Clinic this summer. We're working in the Neurological Institute, and my co-mentors were Irene Katzan, Kay Belowski, Yolanda Parchman, and Laura Gihai. My project is patient satisfaction with pre-appointment questionnaires in the knowledge program. Okay, so first a little background on the knowledge program. It's a group of researchers that work with the Neurological Institute, and they created a set of questionnaires to be answered before appointments, which allows patients to record a self-assessment directly into the electronic medical record through outcome-related patient scales. It includes screenings for patient satisfaction, depression from the PHQ-9 depression scale, general health and pain levels. So it's basically patient satisfaction. It's delivered through tablet computers in the waiting room prior to appointment or through MyChart online at home. So there's also a thing they could do at home if they don't want to do it, or they don't want to do it during their wait before their appointment. The purpose of these pretty much is to provide patients with an outlet to express how they feel about their treatment. So if they have any concerns or they have any symptoms that they want to bring up or they want the doctor to know before their appointment, this would be the time to do it. It's also to provide caregivers with an extra way of checking up on how their patients are doing. So they could get into, or they could look at it beforehand and get an idea of what they'll be looking at. It's also to provide useful statistical data to the clinic as a whole, so like general depression statistics, that sort of thing. It's also to demonstrate efficacy and outcomes to insurance companies, especially when the way insurance is done is going to be changing in the next few years to be focused more on the outcomes of treatments instead of in the treatments themselves. Government agencies, which often fund our research, and to the public, which is our patients. This is a picture of the questionnaire tablet. We would give these to the patients before their appointment while they're waiting. They would come in a little early. There's a stylus attached to the side, and they would use that to click on the numbers. The one problem is there's no keypad to type in a free response or anything like that. It's one of the questions. So most of the questions, they give you a list of choices and you choose one, or you could enter a number, but again, you have to click on the numbers. You can't type it in. The problem associated with this is what we focus our research on, is how do you assess the patient's feelings about the questionnaires themselves? So how do you know, especially after patients have been filling it out every visit, how do you know how they feel about that? Some may be glad to have an extra way to communicate their concerns and problems, and from those people we get good data and everybody's happy. Some, however, may see them as annoying, especially after repeatedly being asked the same questions. In the Neurological Institute, people have to fill out one of these pretty much every appointment. It just sort of depends on the center, and people get pretty upset about that. And some people I've seen have been close to this level of anger. But what we were doing is called the Patient Satisfaction Survey. Basically, it's been done for the last 3 years or so 2009, 2010. It's been altered a little bit since then, but it's a 15-question survey given in paper form after the appointment. So after the patient has checked out, after they've scheduled their next appointment, that's when we would approach them in order to give them this questionnaire. Questions concern like how physicians review questionnaires, how easy they are to understand and answer, and leaves free space for comments and suggestions, which was missing from the original questionnaire. Designed to evaluate patient satisfaction with their electronic questionnaires taken prior to their appointment in the Neurological Institute. So just to see how patients feel about using that or having to use the computers for that. What me and Dr. Katzan focused on was question number 9, or having a system that allows my doctors to more accurately assess how I am doing is a benefit of the Cleveland Clinic Neurological Institute. And this is sort of the most important point of the entire survey, is do they see the benefit of it, or do they feel that it has a benefit towards their treatment? So this leads to my hypothesis. The majority of patients completing the patient satisfaction survey will feel that the pre-appointment questionnaire system is beneficial, which means that response to question 9 is agree or strongly agree in more than 50% of the patients. Okay. So the methodology, this you can see here the characteristics of the study group. Mean age was around 43, slightly more females than males. The PHQ-9 score, that's the depression scale, averaged around mildly depressed. The mean EQ-5D or quality of life test, a perfect life would be 1, so this is pretty good. Patient satisfaction surveys were administered to patients by myself and by a volunteer college student. Okay. Responses were then entered into an Excel spreadsheet. Most of the information also came from previous years of using the study. So most of the data that I used for my analysis came from 2009, 2010. Data collection for 2011 is still ongoing, so we didn't have enough of that from this summer in order to analyze. Okay, the results. As you can see, this was based on a Likert scale, so minimum was 1 or strongly disagree, and the maximum was 5 or strongly agree. These are some of the questions that were based on that scale. We were focusing on question 9, or is it beneficial? And the mean score is 4.13, which means that it seems that it is beneficial. One of the things that we noticed with this table is that question 8 has the lowest mean score, or below neutral. And I thought that that was be a big concern if the doctor wasn't actually reviewing it with the patient. So this is a breakdown of question 9 responses. As you can see, almost 50% strongly agreed that this was a benefit of the Neurological Institute, and over 75% agreed or strongly agreed out of 325 people from 2009-2010. So this right here supports my hypothesis that over 50% of people would agree that it's beneficial. We also stratified it according to different variables. One of the most significant factors seemed to be that as patients got older, they gave a more negative response to the question 9. It seemed to be the best responses were around from 20 to 60, but once they got older than that, it dropped down. There was also a slight difference between 2009 and 2010, but that's probably because of the difference in age groups. Like there was more older people in 2009. So they sort of skewed the data. And that difference could be attributable to older people have a lot of appointments, they're in a lot of pain, so they might view us taking up their time a little more negatively. This is relating all the questions to question 8. So if the pre-appointment questionnaire wasn't reviewed with a physician, it seemed to be pretty significant that the scores would be lower on the rest of the questions. So this means that it means that if the patient or if the doctor didn't go over with the patient, that seemed to relate to lower scores on the rest of the questions, so a more negative view of the pre-appointment questionnaire in general. What we can conclude from this is that the majority of patients, over 75%, felt that the patient questionnaire was beneficial. One of the factors associated with perceived benefit was age, so as the patients got older, they tend to have a less perceived benefit. Another important factor affecting overall satisfaction was whether or not the information was reviewed by the nurse or physician, so that seemed to bring down the scores overall if it wasn't reviewed by the physician. And the recommendations we can draw from that is that physicians should be encouraged to review questionnaires with their patients. So that means educating physicians in looking through the questionnaires and how it could help their patients by improving treatment. Also, pre-appointment questionnaires are still overwhelmingly considered to be a benefit by patients, so there used to be continued, because it seems like we're doing a good thing here, and it seems like most people see them as benefits, just a few things that we can tweak to improve it. Some common complaints voiced by patients, and we also kept track of free response section of what kind of complaints they had. Is mostly applicability of questions to specific conditions and overall usefulness in practice. So if people had headaches and they were being asked questions about depression, or they had trouble moving and they were being asked questions about headaches, they didn't feel like it applied to their appointment, so they didn't see the usefulness of the questionnaire at all. So both of these should be targets of improvement in the future. And yeah, so this is a good system. We could still work on it a little bit, but overall it seems to be beneficial. So acknowledgements. So I'd like to thank the staff of the Knowledge Program, especially Kay Belowski, Dr. Katzan, who helped me with planning out my project and with all the statistical stuff and going it over with me, which was really helpful, especially since we started when I had 2 weeks left before it was due. And all the doctors in the Neurological Institute, especially the front desk staff, who were really nice to me the whole time. I'd also like to thank the Office of Civic Education Initiatives for the opportunity to participate in the program this summer and for the last couple summers.